So today I'd like to speak about HPV, the Gardasil vaccine, abnormal pap smears. We'll see how far we can get. HPV stands for human papilloma virus. That is technically a wart virus. It's the same virus that causes warts on your hands or wherever you have them, other than the genital area. There's a very specific subset of types that affects the genital area. And some of those are classified as low risk and some are classified as high risk. And that's low or high risk for cervical cancer. Now, all cervical cancers are caused by human papillomavirus. So since the beginning of, and I won't say time, but whenever they started collecting specimens on women who had cervical cancer, they kept them for a long time and they were stored in these research facilities. Well, they went all the way back through all of those, and every single one of them, the cells had been transformed by human papillomavirus that turned them into cancer cells. That just means cells that don't act normally, get aggressive, and can spread throughout your body. Now, backing up, that's what HPV is. Is there a way to prevent it? Let's start with prevention. There is, nowadays, there's something called a Gardasil vaccine. It is specifically a vaccine to prevent certain types of human papillomavirus. Now, out of the 14 high-risk types, it only protects people from 7 of those. The other 2 types it protects you from are the ones that are more likely to cause visible genital warts. So it's actually called Gardasil 9. It's evolved since it first came out. Now it will protect you from 9 types. Who can have that vaccine? Well, in the beginning, when it first came out, my goodness, that was 18 years ago. It was for a specific age group of women, girls. Then, as time has gone by and more research has been done, it's now recommended for boys and girls, men and women, and there are almost no age limitations. I've had women in their 40s ask for it. But mostly, the younger you give any vaccine, the younger age that you give any vaccine, the better the immune response is going to be. In other words, the body is more likely to develop a vigorous immune response so that if that person is exposed to that virus, it's more likely to prevent it from infecting them. HPV, by the way, is everywhere. 80% of the population in my age group has it. Probably a larger percentage of the population that's much younger also have it. It is just everywhere. So don't think that you can't get it because you've only had sex with one person ever, because you don't know who that person has had sex with, regardless of what they tell you. And, by the way, it is spread by sexual contact. I don't think I mentioned that in the beginning. So, the risks of HPV are cervical cancer, genital warts that can be in the vagina, on the labia, around the anus, inside the rectum, inside the mouth and airway. Let's not talk about the oral HPV at this point in time. And I'm not discussing men because I take care of women. So we don't see a lot of visible genital warts anymore. I'm not sure why. Maybe that viral type has been resting for a while. We certainly see enough abnormal pap smears, and that's what happens when someone has usually it's a recent infection with HPV, but not always. People who are recently infected, it may take 10 months to a year for the virus to become instilled enough to change the cells enough to cause an abnormal pap smear. And if you're not getting a pap smear every year, you're not going to really know until you have another pap smear. Older women, and I've seen this, as they age and their immune system becomes less effective, can have a resurgence of an HPV infection they never knew they had, haven't been sexually active in 20 years, only ever had sex with their husband who is now dad, and they come in with an abnormal pap smear due to HPV. It's a little disconcerting and difficult to explain, but basically anything can happen. And so the most frustrating thing for me, I guess, is that there's not a lot of talk in teaching kids in junior high or high school about HPV. And it's so prevalent and can be such a problem. Just my personal frustration. One other little tidbit about HPV is that for your body to get it under control and what I call beat it back into submission so it's inside the cells and dormant, you gotta be healthy. Your immune system has to be healthy. And smoking is a huge risk factor because the poisons in cigarette smoke, of which there are thousands, concentrate in cervical mucus, which is where we're doing the pap smear on the cervix, screening for cancer. So smoking also suppresses your immune system, which is your body's ability to fight off this virus. So it's like a double whammy. And that's one of the first things I try to do is counsel people to quit smoking. Also, if you have an abnormal pap smear, don't immediately start thinking you have cancer because you probably don't. Most people don't. They come in, we do another test on them, look at the cervix through a microscope, do a biopsy or not, and send it off to the lab and then make a plan on how to get rid of the abnormal cells. So I guess I've drifted over from just HPV and Gardasil into abnormal pap smears and what causes them. And I think it's important information that you have. None of us are immune to the risk, I should say. I maybe should have led with this, but what is a pap smear? A pap smear is a screening test for cancer of the cervix. We rarely see cancer of the cervix anymore, especially in people who are coming in for regular exams. Most of those people that end up with cervical cancer are the ones that haven't had a pap smear in a very long time, and they come in because they're having something abnormal going on down there. But it's just a specimen from the outside of the cervix that's sent to the lab to look for abnormal cells. The cervix itself, which is the lower part of the uterus, is a particularly sensitive area. It's changing constantly from one cell type to another, and that puts it at risk for this virus infecting it and getting into the cells and changing them. But it was figured out more than 50 years ago that if you get a sample of cells and look at them under the microscope, you can tell which women will continue to get more of a problem and end up with cancer. That's what the pap smear is. Very useful. The guidelines for doing pap smears has changed a lot as well. In the 80s, we did pap smears on everyone every year, regardless of age. Now, as I said in another setting, we start doing pap smears at the age of 21. Not because people under 21 aren't going to get HPV, but because they're young, the likelihood that they're going to have an infection that they can clear by themselves fairly rapidly is very high. Even if they haven't had the vaccine, they're young, they're healthy, their immune system is healthy in most cases. So at age 21, when we start doing them, if we pick up an abnormal pap smear, we proceed with the next step of trying to figure out what it is, how bad is it. Let's say it's all normal, age 21, normal pap smear or a negative HPV test. In our office, we do pap smears. If it's negative, they don't need another one for 3 years. This has started changing about 18 years ago, and it's gotten progressively better in terms of how often pap smears are done. About every 6 years, the powers that be that know all these things and look at all the research come out with a new set of guidelines. So every 3 years until you're 30. At age 30, we add the HPV test itself to the pap smear. So both tests are run, HPV and pap. If both of those are negative or normal, that woman doesn't need another pap smear for 5 years. Notice I'm focusing on pap smears. I didn't say they don't need another exam. You really should get your annual exam for reasons I'll go over in a different segment. But 5 years, another pap smear and HPV. Now, if a given person has had a history of dysplasia in the past, then they need pap smears with HPV every 3 years over the age of 30. So that's a little bit different. And there are a lot of other qualifiers about who needs the next step in testing. So I realize that's a lot of information. The takeaway is HPV, or human papilloma virus, is everywhere. Everybody has it. It has the potential to cause cervical cancer, but it doesn't need to. It can be prevented if you're getting the care that you're supposed to be getting annually. Thank you.